is there going to be a different approach to starting keto if you're hypertensive? Being
Yep.
in ketosis for a few months is bad for you. You're eating low carb, you're doing it properly, but when you wake up in the morning, your glucose is high, but after meals, your glucose is low. What's happening? I made a mistake explaining this because I said that if you eat too much protein, gluconeogenesis, and then it will be converted into glucose. So I believe I was wrong. So can you
Yeah.
please correct me? First question, I'm really interested to know, is diabetes really irreversible or not?
So if you're talking about type 1 diabetes,
Mm-hmm.
then currently it is a chronic progressive condition, but it does not have to result in
Mm-hmm.
all of the damage and complications that most type 1 diabetics suffer from.
Mm-hmm.
If you're eating an inappropriate diet with type 1 diabetes, then your blood sugars are going to be chronically high. Your A1C is going to be really high. You're going to have to take a lot of insulin in order to try and control your blood sugar, but you're still going to open yourself up to hundreds of different complications and bad outcomes.
Mm-hmm.
If, on the other hand, you're eating a proper human diet with your type 1 diabetes, you're still going to have type 1 diabetes, but your blood sugars are going to be very controlled and very low normal. Your hemoglobin A1C can, in fact, be normal as a type 1 diabetic, which most type 1 diabetics could only dream of. They don't realize that that's even a possibility. But it's absolutely possible if you eat a nutrient dense, real food, whole food, very low carbohydrate diet. And some people call this a ketogenic diet. Some people call it a very low carb diet. Some people eat what they call a ketovore diet. That's what my wife Nisha eats. I currently am eating a carnivore diet, which is almost all fatty meat. And so the biggest risk factor for a type 1 diabetic, for heart attack, for stroke, for losing a leg, for having to go on dialysis, having kidney failure, for developing blindness, is eating too many carbohydrates and then therefore taking too much insulin. Those are the dangerous things for a type 1 diabetic. Now, if you're talking about type 2 diabetes, that type 2 diabetes is really misnamed. It really should be named carbohydrate toxicity syndrome. Type 2 diabetes is completely reversible. I haven't seen a single case that couldn't be completely reversed. And so the person winds up having a normal blood glucose level, a normal hemoglobin A1C, and a normal C peptide and a normal fasting insulin with a low enough carbohydrate diet for long enough. The type 2 diabetes just goes completely away because basically the type 2 diabetes was just carbohydrate overdose.
Oh wow, that's a relief because a lot of my family members, friends of my families, even our neighbors have like diabetes type 2. Some end up like having to use insulin because it's just getting worse. So for someone who wants to try ketogenic diet, I always tell them, like, if you have diabetes, ketogenic diet is good for you.
Yes.
What I always hear is that they cannot try ketogenic diet because it's a very low carb diet and they need their carbs in order for them to survive.
Yep.
So what can you
And
say about that?
well, a lot of type 2 diabetics, they believe that because that's what their doctor told them, or
Yeah.
their dietitian, or their nutritionist, or their other healthcare provider told them. And this is completely wrong. There's no truth to this at all. Uh, as a type 2 diabetic, slowly decreases the amount of carbohydrates they eat on a given day. And I definitely would counsel a type 2 diabetic, the first carbohydrates you need to get rid of are all the sugars. So all of the added sugar, all the junk food, cookies, cakes, pies, candy bars, all that stuff, that is literal poison for a type 2 diabetic,
Mm-hmm.
right? And
Yeah.
so that should be the very first carbohydrate that you should remove from your diet as a type 2 diabetic because it's poison. The second thing they need to remove is all the grains. whether it's rice, wheat, oats, corn, it doesn't matter. All of these grains are very high in starch. And starch is a molecule that's basically just a bunch of sugar molecules holding hands. That's what starch is. And so I know in some cultures, rice is considered almost a religious food. Like, what
Yes.
are you talking about? Don't eat rice. Yeah, if you're young and metabolically healthy and you don't have type 2 diabetes, you can enjoy some rice occasionally. It's
Mm.
probably not a big deal. But if you've already progressed down the metabolic disease pathway to the point where you've been diagnosed with type 2 diabetes, you are in trouble. You are in danger, and you need to get rid of all of the grains, including rice. Rice, and there's a big argument between white rice and brown rice and polished rice.
Mhm.
But all a type 2 diabetic has to do is eat a big bowl of rice, wait 1 hour, then check their blood sugar. And there'll be no doubt what the rice did to their blood sugar. And then that'll be good evidence for them to get rid of the rice and other grains from their diet. The third thing a diabetic should absolutely do, either type 1 or type 2, is get rid of all the vegetable oils
Mm.
because they're very high in omega-6 fatty acids. They're very inflammatory, and they probably contribute more, much more, to the clogging of the arteries and to heart disease than almost any other thing. And so this includes canola oil, soybean oil, corn oil, peanut oil, safflower oil. All these things have an omega 6 fatty acid level that's far too high to be healthy for human beings. And for the average type 2 diabetic, just removing those three categories of things is going to make their blood sugar move to a much healthier range. And you got to remember the sugar that's in fruit and fruit juices, your body cannot tell the difference between that sugar and the sugar in a candy bar. Your body cannot tell the difference between glucose and fructose from a glass of delicious papaya juice or orange juice than between a Coca-Cola or a Pepsi Cola. Your body can't tell. And so the sugar from a glass of fruit juice is going to spike your blood sugar and raise your A1C as just as much as a glass of Coca-Cola or Pepsi or Dr. Pepper. Your body can't tell the difference. So many type 2 diabetics realize very early that they can eat some raw fresh fruit as an occasional treat,
Mhm.
but they have to cut back on just eating fruit with every meal and drinking fruit juices, especially making fruit juice smoothies. These things are not things that are healthy for diabetics, because what it's important for a type 2 diabetic to understand is if you have a blood sugar of 250, I don't know, do you guys use that system of
Yeah.
measuring blood sugar? Yeah,
Mhm.
okay.
Yes.
So if you've got a blood sugar of 250, I don't care what your cholesterol level is, because that blood sugar level is so supremely dangerous and so damaging to your body. It becomes irrelevant what your total cholesterol level is or your LDL cholesterol. Having high blood sugar, having a high A1C is 10 times or 20 times more dangerous than having a high cholesterol.
Mhm. But so previously you said that you just need to remove the sweet sugars. But what about the artificial sweeteners? You know, those keto approved
Yeah,
sweeteners.
as you're transitioning to eating a low carb diet, a keto diet, I think it's fine to use the artificial sweeteners kind of as a tool to
Mhm.
transition into a lower carbohydrate lifestyle that you're going to follow for the rest of your life. Because my research is leading me to believe that human beings, all of us, are by design a low carbohydrate mammal. We're not designed to eat a high carbohydrate diet. And so if you need the tool of an artificial sweetener or stevia or monk fruit extract or xylitol or erythritol, if you need that sweetness to help you get away from the Coca-Colas and the Pepsi Cola, I think that's fine. And so switching from regular Coca-Cola to Diet Coca-Cola, that's a big improvement for a type 2 diabetic as a first step. Now, there are many type 2 diabetics that just the sweet taste of the artificial sweeteners will slow down their progress. We'll keep their insulin level too high. We'll slow down their weight loss if you're overweight and you're trying to lose weight. And so many people use diet soft drinks and artificial sweeteners for the first few months of transitioning to a ketogenic way of eating. But many of us find that that at some point we have to stop those sweeteners too, because they absolutely raise your insulin. They absolutely, especially if you were addicted to sugar, like many of us
Mhm.
are, then that artificial sweetener can actually call up your previous sugar addiction and make you start having cravings for all of that junk food that you thought you'd left behind in your life.
It's very hard for us Filipinos to actually follow consistently keto diet because like not all of us but most of us, because life rice is everywhere, like breakfast, lunch, and dinner. If you tell
Yep.
someone that you're not eating rice, it's like, how can you live? You
Yep.
need to eat rice. And
Yep.
just a while ago my grandmother was telling us like, you're so unhealthy because you're not eating rice. What's happening to you? Because me, my
Yep.
mom, my husband, and my sister is no longer eating rice, so they are always telling me that you are unhealthy.
Yeah,
Stop
you look
doing
very
that.
unhealthy. Yeah, you look very unhealthy. You could die at any moment from your
Yeah,
rice deficiency, right?
yeah,
Yeah. And
exactly.
so much of what we believe about
Mhm,
food is knowledge that we've
mhm,
inherited from our mother and father or our grandparents, and it's not based on anything. And so, your grandmother's not a nutritionist, I bet, right? And so she doesn't actually know what amount of protein is in rice, what vitamins, what minerals. She doesn't know. She's repeating to you what her grandmother taught her. And 50,000 years ago, that was an excellent strategy for
mhm,
learning what to eat and what not to eat. But our current mythology has been so captured by the big food manufacturers, the companies that sell rice and that sell corn and oats and wheat. It's been so captured that you can no longer really trust your grandmother to teach you what to eat. Whereas 50,000 years ago, you would be an idiot not to listen to your grandmother,
mhm,
because she could tell you where the nutrient dense foods were from trial and error, from what she was taught by her grandmother. And so it's very instinctual in humans to listen to our grandmother and our mother, because that used to be an excellent strategy to not eat that poison plant, or to not eat from whatever that was going to cause disease or death. You had to listen to your ancestors or you would die.
mhm.
But now their beliefs have been hijacked by the food companies that sell carbohydrates, basically, right? And
Yep.
so now we're in this precarious position of having to teach our grandparents, no, grandma, that's not right. You've been tricked, you've been fooled, and I know you believe that, and I know you're trying to help me, but rice is not, it's not going to help me in any way except to help me put on a few pounds in the middle and raise my blood sugar. That's all rice is going to do for me.
I was talking to some of my friends and family members who are diabetic, and the only thing that they are currently eating is rice and vegetables, because
Yep.
those are the only healthy food that they're allowed to eat. And then they're
Yep.
complaining about their joints, about their heart, about their increasing number of maintenance. But I
Yep.
cannot tell them to do this because what you're eating is making you feel
Yeah.
bad.
And it puts you in an awkward situation, because these are your elders.
Yep.
These are people that you look up to and respect and love, and you want the best for them. But here I don't know if you have this saying in there, but in America we call this powdered butt syndrome.
Mm-hmm.
And what it means is, when you were a baby, they all changed your nappy. They saw your dirty little butt, they cleaned it up, they powdered it up and put a nappy on you, right?
Mm-hmm.
And so in that structure, you can't ever be right, because they've seen you, that they've powdered your naked little butt. And so that means you can never be right. Even if you were a brain surgeon and a rocket
Yep.
scientist, they still couldn't listen to you. And
Yeah.
so younger people, we have to use ninja tactics to help our uncles and aunts and mothers and fathers and grandparents. And so instead of you trying to convince grandma, no, the rice is going to raise your blood sugar, you're going to have to find one of grandma's friends and
Mm-hmm.
teach them about keto. And then when they tell grandma about keto, she'll listen to them. Does that make sense?
Yep.
And then before you know it, your grandmother will be trying to teach you about keto. And you'll be like, yeah, grandma, I know. But you can't really teach your aunts and uncles and your parents and your grandparents because you've got powdered butt syndrome. They
Mhm.
powdered your naked little butt, and they just can't take advice from you because they still in their heart and their mind, they see you as that little girl.
Yeah. That's exactly what I did with my mom. Like, I never taught anyone about what I was doing because I know that my mom will be against it. So
Yep.
after a few months, like, my I can sleep better. All my skin rashes, my psoriasis is gone. My skin became better and everything. When she saw what happened to me, she was like, "So what are you doing now?"
That's the experience of most people who give a ketogenic way of eating a 30-day, 60-day, 90-day trial,
Mm-hmm.
because most people when they start keto, they're just trying to lose weight. And they're like, I know sugar and rice makes me fat, but I love it. And I mean, it's not really like it's poison. It just made me fat. But when people start to see, wow, my skin got better, conditions that I've had for years went away. My joints don't ache anymore. It's that kind of feedback from your body that kind of helps you understand, no, it is poison. I mean, it was causing chronic inflammation in my knee or in my stomach or in my skin, or and so if it's causing inflammation in those places, where else is it causing inflammation? And when you start to have that kind of conversation with yourself, you start to come to see rice and sugar and all the other carbohydrates as literal poison,
Mm-hmm.
because now you like your new skin and you like that your knee doesn't hurt and you like that you don't have heartburn and reflux all the time, and you don't want that to come back because that sucked. And so then you become like your friend. You're like, no, no rice, thank you. Yeah, I'm happy to be unhealthy because I like my new body. I don't want to mess it up again. And what we're really trying to do here is we're trying to shift the paradigm for people to rediscover that human beings are by design low carbohydrate mammals that should eat lots of meat in their diet, whether that meat is seafood or poultry or red meat, goat, sheep, chicken, it doesn't matter. Human beings are designed to eat very few carbohydrates and to eat lots of fatty meat. And when you start feeding a human being that diet, which is a ketogenic diet or a ketovore diet or a carnivore diet, things that we thought were conditions we would have for the rest of our life start to get
Yeah.
better and go away. And how powerful is that? That some diagnosis you thought you were stuck with for the rest of your life, and you're going to have to take a pill or two pills or three pills every single day for the rest of your life. That condition's gone, and you don't have to take that medicine anymore. That's very powerful positive reinforcement that, yeah, humans are not supposed to eat all that rice and all those desserts and drink all the fruit juice. That is not healthy for our species. It's not a species appropriate diet. It's not part of the proper human diet.
Mm-hmm. Yeah, exactly. But now the problem is some of the doctors, dietitians are saying that, okay, you can do keto for short term in order for you to lose weight, but don't do it for longer term because being
Yep.
in ketosis for a few months is bad for you.
Yep. And
So,
so now we're talking about doctors and dietitians.
mm-hmm.
So you got to be respectful and loving with your grandmother. You cannot be disrespectful to grandma. But when it comes to a doctor or a dietitian or a nutritionist or another healthcare provider, it is their duty to understand the physiology and the biochemistry of the human body. That is their calling, that is their desire, and that is their job. And so when they say something stupid like that, like being in ketosis long term is harmful or bad, then you get to be a little bit disrespectful. And you can still do it in a respectful way, but I would, my first question would be, really, I did not know that. Can you explain the science to me? How is that possible? Because there are many cultures around the world for hundreds of thousands of years that were in ketosis every day. They ate nothing but fat and protein, and they did great. They did fine. They were very lean, very muscular, very healthy. Their teeth were perfect. They had maybe one cavity their entire life. How's that possible? Explain that to me. And they're not going to be able to explain it to you because all they're doing is they're repeating a lie that they heard from another healthcare provider. And so it's our duty to kind of lovingly take these healthcare providers by the shoulders and shake them a little bit and say, what are you talking about? Show me the studies that prove that. Explain the physiology to me, because I've looked into it and I can't find any biochemical pathway where we're eating lots of healthy fat and protein and a little bit of veg. I can't find any. How's that bad for the human body? Show me how that's bad. And they'll repeat lots of myths, right? They'll say,
Yep.
oh, too much protein's bad for your kidneys, too much fat's bad for your liver, too much fat's bad for your heart. And all you have to do is just keep asking them respectful questions. Say, well, explain that to me. How is eating too much protein bad for your kidneys? Because I believe that too. But then I looked it up and I found that that's a myth, that that's not true at all. That actually, this is well known that your kidneys are made out of protein, and eating protein is good for your body. It's not bad for your kidneys at all. Why do you believe that? And so when you have that conversation with your doctor, you make them very uncomfortable because they like to know everything. And when you reveal that their armor of knowledge has chinks in it, they don't like that. And so they'll immediately go back and they'll try to prove you wrong, and they'll look it up. They'll get their old physiology textbook out and look it up. They're like, no, it's not there. Let me check my biochemistry. Nope, not there. Well, why do I? Then they'll start to question themselves. Like, why do I believe that? I don't know. They'll jump on Google and start researching, and they'll quickly find out that they were just wrong. And then they'll stop saying that. And that's a very powerful thing for someone like you to do, because when you wake your doctor up, how many other patients does your doctor take care of? 100,
Mhm.
1,000, 5,000? Then you've got that. What you've done, first of all, is you've got that doctor to stop saying stupid stuff to you, but you've also helped them to stop saying stupid things to their other 1,000 patients. How powerful is that? You've literally changed how they practice medicine. And that's an amazing thing that just average people can do by asking educated questions of their healthcare providers. And these kind of stupid myths that doctors repeat, that's why I wrote the book that I wrote, Lies My Doctor Told Me, is to help patients, first of all, understand just because your doctor said it does not make it true, does not make it gospel. Doctors are just as likely as you are of repeating a fad diet, or of repeating gossip, or of repeating a myth that's just not true. But the last chapter of my book is written to doctors, basically saying, hey, what's wrong with you? Your job is to know what you're talking about, and you're just repeating these silly myths left and right that have no basis in science, no basis in truth, and you're actually hurting people by saying things like, oh, if you're in ketosis too long, it's bad for you. Where did you get that? Where did that come from? There's no science that supports that. And so, I mean, it's my mission in life to help people like you understand how to get healthy and how to fix your skin and fix your other maladies. But it's also my calling to help doctors understand you are held to a much higher standard. And you can't say dumb things like, oh, too much protein is bad for your kidneys.
Yes.
People are going to stop listening to you if you keep saying those dumb things. You got to step it up a notch. Healthcare providers, doctors, dietitians, you can't keep saying that stuff, because there are now hundreds of thousands, if not millions, of people eating keto, ketovore, carnivore, and they know, they've looked it up, they've done the research, and they know that protein's not bad for their kidneys. They know that ketosis is not harmful in any way whatsoever. And so when a doctor does say something like that to them, that doctor loses all esteem in their eyes. It's like, wow, you don't even know what you're talking about, do you? And so healthcare providers would do well to make sure they know what they're talking about before they open their mouth.
True. And unfortunately, most of the time, the answer that I'm getting is, I'm a doctor. You're not a doctor. I studied this much. You didn't.
Yeah.
So I know
Yeah.
better. So
Yeah.
anyway, I wanted to hear if you. I want to hear from you something about the dawn effect. This is quite confusing because you're eating low carb, you're doing it properly, but when you wake up in the morning, your glucose is high, but after meals, your glucose is low. What's happening?
Yep. So the dawn effect, or the dawn phenomenon,
Yeah.
is a completely natural, normal physiological process. It is not abnormal. It
Mhm.
happens, actually happens to every mammal that's been studied. Okay. From pangolins to panda bears to people, we all have a dawn effect. And so what happens is when you go from the stages of deep sleep and you're waking up in the morning and you're getting up, your levels of adrenaline or epinephrine and your levels of cortisol elevate. That's how you wake up in the mornings, right?
Mhm.
And that's normal. That has to happen, or you would never wake up. And so when your cortisol goes up and when your adrenaline or your epinephrine goes up, that raises your blood sugar. It's a transient effect. It only lasts for 30 minutes to an hour. But it's normal. A lot of people you hear out there say, "Oh, that the dawn effect's bad." No, it's not bad. That must happen. And so the knowledge about the dawn effect makes it a non-issue because now you know that. So if you're still a type 2 diabetic, you're not going to check your blood sugar immediately when you wake up. You're going to wait an hour to let the dawn effect play out, right? And so your cortisol level and your adrenaline or epinephrine goes back to normal. Then your blood sugar is a nice fasting blood sugar. But all mammals have this. It's not abnormal. I've got a YouTube video about it that goes into more detail. But this is, again, another thing a lot of dietitians and doctors will tell people: the dawn effect, oh, it's bad. No, it's completely physiologically normal. You just have to know about it and then not freak out about it. So don't worry about the dawn effect. It's just a completely normal thing that happens to every human being on the planet every single morning of their life.
What about keto diet for hypertensive? Because keto diet is high fat, fat is bad for hypertensive. So,
Yeah, that's what you hear, right? But so the so many hundreds of thousands of people have lowered their blood pressure
mm-mm,
with a ketogenic diet. And here's how that works. When you're eating a high carbohydrate diet, your blood sugar is going to stay high all day long, and that's going to make your insulin level high all day long.
mm-hmm,
Both of those conditions make you hold fluid or water in your body. And this is why when somebody does start keto, they lose anywhere from 5 to 20 pounds in the first week or two. That's not fat that they're losing. That's all the extra unhealthy water that they were storing all over their body. That's fluid that their heart was having to beat for no reason because they had chronically high blood sugar, chronically high insulin levels. And so when you start to eat a lower carb diet, your blood sugar comes back to normal, your insulin comes back to normal, and that allows you to urinate away all of that unhealthy extra fluid that you're holding on to. That's not healthy to hold all that extra fluid. It makes your heart work harder, it makes your kidneys work harder. And so it's a good thing. But one of the main things that happens when you lose that 5 to 20 pounds of water weight is that your blood pressure comes down, because one of the things that causes high blood pressure is a higher blood volume. And if you're holding on to 20 pounds of extra fluid, you're going to have more blood volume. That's going to make your blood pressure higher. And many people are taking one or two or three different medications to lower their blood pressure. When they go keto after a month, they got to stop one of those medicines, or their blood pressure will actually start to be too low and they'll get dizzy and lightheaded. After another month, they have to stop another blood pressure medication. And so they go from being on three medicines for blood pressure down to maybe one or maybe none, because their blood pressure just goes back to normal or very close to normal with a ketogenic diet.
mm-hmm. But is there going to be a different approach to starting keto if you're hypertensive?
No,
Or
no, you do the three steps: stop all the
mm-hmm,
sugar, stop all the grains, stop the vegetable seed oils, eat lots of fatty meat, and your blood pressure is going to come, it's going to either improve or return completely to normal within a few months of eating a ketogenic diet. There's no reason that someone with high blood pressure or hypertension should do anything differently. The majority of their hypertension is caused by the chronic hyperinsulinemia that is caused by eating a high carbohydrate diet. And so when they stop eating a high carbohydrate diet, their insulin level is going to start immediately to go back to normal. And when that happens, they lose all the excess unhealthy fluid they've been holding. and their blood pressure returns closer to normal.
Mm-hmm.
So the ketogenic diet is one of the. I mean, people with hypertension absolutely should eat a ketogenic diet because it's going to help improve their blood pressure.
Mm-hmm. But a lot of people are scared because of high LDL, high cholesterol.
A high blood sugar is 100 times more dangerous for you
Mm-hmm.
than a high LDL. Okay. And I know that all your doctor wants to talk about is your LDL. That's all they want to focus on. But there's more emerging research coming out every day. And there's actually old but good research that's been hidden because people didn't want to talk about it that shows without a doubt that having a high blood sugar is 10 times, 100 times more dangerous than having a high LDL. So, you know, if you had to get hit by a car, would you rather be hit by a tiny little sports car or by a humongous bus? You got to pick. I'd rather be hit by the tiny little motorcycle or sports car than to be hit by the bus, right?
Yep.
Well, having a high blood sugar, that's being hit by a bus. Having high LDL may be dangerous, maybe not. We're still kind of figuring that out. But it's like being hit by a little scooter. So if you had to pick, which one would you rather be hit by, the bus or the scooter? That's the difference between having type 2 diabetes, having high blood sugar, having chronically high levels of insulin. That's very, very, very dangerous and likely to kill you. Having a high LDL might increase your risk a tiny bit, but not nearly as much as having high blood sugar. It's just having high blood sugar is more dangerous than having high LDL.
Mm-hmm. Since keto diet is a high fat and moderate protein, what's gonna happen if you eat too much protein? I think I explained it differently before, or I made a mistake explaining this because I said that if you eat too much protein, gluconeogenesis, and then it will be converted into glucose. So I believe I was wrong. So can you
Yeah,
please correct me?
yeah. So very early, when the ketogenic diet was becoming popular, there were some gurus out there who said that, oh, you need to not eat too much protein. It'll make your body go into a process called gluconeogenesis. And that's just not true at all. If you're
Yeah.
eating a very low carbohydrate diet, there are many people out there who do very well on a high protein, moderate fat ketogenic diet. But most people do better on a high fat, moderate protein ketogenic diet. But what they both have in common is that they eat a very, very low amount of carbohydrate. Eating the low amount of carbohydrate, that's what puts you into ketosis. And that's what contributes to weight loss and improvement of skin conditions and gut conditions and joint conditions. That's what fixes that. It's not the high fat or the high protein.
Mm.
Um, a good friend of mine, Dr. Ted Naiman, has a book called the PE diet, and he advocates a high protein, moderate fat, very low carbohydrate diet, and that works very well for some people. For other people, a high fat, moderate protein, very low carbohydrate diet works best for them. But if you're eating low carb, you're not going to be able to eat enough protein to spike your blood sugar via gluconeogenesis. The physiology just doesn't work that way. But that was something that you heard very commonly a year ago. Yeah, but it's not true. If you're eating low carb, your liver, so the process of gluconeogenesis is not a bad thing. It's a good thing. It's just like the dawn effect. It's normal. It's good. It's okay. Don't worry about it. If your body needs glucose to feed your red blood cells or another cell, your liver can make glucose at a moment's notice. That's why we don't have to eat glucose. We don't have to eat sugar because our liver can make it if we need it. And your liver's not stupid. Your liver's very wise and very ancient and very powerful. It's never going to just make glucose if you don't need it. It would never do that. It's too smart for that. So don't worry about eating too much protein. Most people in the United States, and I would guess most people in the Philippines, don't eat enough protein.
Mm-hmm. Yep.
Protein is very important for optimal health. You've got to eat a good supply of protein. And I think most people don't, especially the rice eaters. They don't eat nearly enough protein. So I would much rather you err on the side of eating more protein if you're in doubt, because protein is good for you. It is not bad for you. Now, I'm not talking about protein powders and protein shakes and protein bars. I'm talking about protein that comes from good fatty meat. That's the kind of protein we need to be eating, whether it's from seafood or from poultry or from red meat. That's the best protein in the world for the human body.
But what about protein shakes, protein powders? Is it good or bad for keto?
Well, I think that it's possible that you might get too much protein too quickly from a protein shake or a protein powder or bar. The protein in meat is our ancestral food. That is an ancestrally appropriate food. It is perfectly formulated to give us every amino acid we need at the right biochemical rate. But so somebody's taken a source of protein. First of all, what kind of protein is it? Where did it come from to make this protein shake?
Yeah.
Who's in charge of that? Do you trust them as much as you trust the sheep or the goat or the cow or the chicken to make you protein? I trust the animal to make me protein because that's the way it's always been done for human beings on this planet. I don't know the manufacturer of that protein powder. I mean, is that good quality protein? Is it pea protein? Where did it come from? Did they put too much? Is the ratio wrong? Are the amino acids right? When I'm eating meat, I don't have to ask any of those questions because humans have been eating meat for our entire time on this planet. But if I'm now drinking some artificial new fad protein shake, I don't know. Can I trust that company or not? And
Mm-hmm.
so that's kind of my take on it. I don't think it's necessarily bad, but I think for most people, especially if money is an issue, eat meat and don't waste your money on a protein powder.
Yeah, and I understand that you're doing carnivore diet now, right?
Yeah, which is a subset of the ketogenic way of
Mhm.
eating.
Yeah, but for someone who is like um healthy now because of the ketogenic diet,
Yep.
someone who loves his or her vegetables, green leafy vegetables,
Yep.
why should you consider going to carnivore diet?
Well, in that situation, I don't think you should consider going carnivore. I think you should keep doing exactly what you're doing that's giving you the health improvement that you're enjoying,
Mhm.
right? So, but some of us should eat such a low carbohydrate diet that it basically eliminates all the plant foods. And I'm one of those people. I used to be morbidly obese. I used to be pre-diabetic. I used to have fatty liver. I used to have eczema. I used to have knee arthritis. I used to have terrible heartburn, reflux. All that's gone now. Now, all that stuff got 80% better on keto,
Mhm.
but it didn't go completely away from me on keto like it does for you and others. And so I had to lower my carbohydrate as low as I could possibly get it. And that's why I say carnivore is a subset of a ketogenic diet. It's just the ultimate, the lowest carbohydrate diet you can actually possibly eat is a carnivore diet because
Mhm.
there's almost no carbohydrate in meat. And so my diet consists of meat, butter, eggs, and real full fat, real fermented cheese. That's what I eat. And on that diet, on the carnivore diet, all of my symptoms are gone. I feel better now at 51 years of age than I felt when I was 35. And that's a big thing to say, right? But now many people, including you, it sounds like, are doing great on a ketogenic diet that's full of vegetables. And I don't have that. I think that's wonderful. The human diet should consist of meat for everybody without exception. For some people, they can enjoy lots of vegetables. For some people, they can have a few vegetables. For some people, for ultimate optimal health, they need no vegetables at all. You get to pick. And that's why I call this the proper human diet spectrum. Because on one side of the spectrum are people like you who eat some meat and some eggs and some cheese, but they eat lots of vegetables and they're doing great. That's fine. That's part of the proper human diet. All the way to the other extreme is people like me who had to turn down their carbohydrate intake as much as they possibly could to reverse all of their chronic conditions. And so that's me. That doesn't mean you have to do that.
Mhm.
You get to pick anywhere on the proper human diet spectrum from lots of veg and a little meat to lots of meat and very little veg to just all meat. Any of those are ancestrally appropriate. Any of those are proper for a human being to eat,
I see. But what if you cannot afford those like grass-fed beef or
right?
eat steak every time? Is
No,
it
and
still
so you
healthy?
don't, yeah, you don't have to worry about buying the expensive grass finished meat. And I actually have a YouTube video about
Yeah.
cheap keto. You can literally do a good ketogenic diet with spam, with minced beef, with all the cheaper cuts of meat. You don't have to buy the expensive meat to do keto right. And so if money is an issue, and it is for many of us, you can eat veg and you can eat the cheaper cuts of meat. I don't know what the canned meat is in the Philippines. Do you guys have spam?
We do, but it's expensive.
Ah, gotcha, gotcha. For many people in some areas of the world, seafood is a cheaper option
Yes.
than red meat, and that's totally fine. You can eat all the seafood can be a huge part of your ketogenic diet and be very, very healthy. And
Mhm.
so, whatever the cheapest meat for say in some areas of the world, uh, chicken, poultry, and turkey are very, very cheap compared to red meat or compared to seafood. That can be your keto. You need to do the best quality keto you can afford. In my experience personally, and in my research, it looks like that ruminant meat is probably the best meat for human beings, and that would be sheep, goat, cow, and then wild ruminants. That seems to be the best quality meat for human beings. But if you can't afford that, you got to do the best you can do, right?
Mhm.
And so maybe seafood is all you can afford, totally fine. Maybe poultry, chicken is all you can afford, totally fine. But you got to do the best you can do, and there needs to be some kind of meat in your diet. Needs to be eggs in your diet. I think all over the world, eggs are pretty cheap for most people. Yeah, you can
Mhm.
eat lots of eggs on a keto diet and get all of the amino acids you need, all the fatty acids you need, all the vitamins and minerals from eating lots of eggs and your veg, and then every when you can afford it, having some meat in addition. That's a great ketogenic diet.
Yeah, I actually saw your video about that, like the cheap versions of carnivore
Yep.
diet, and that's what led me to starting carnivore diet. Because I don't really have that much money to spend, like to eat steak every day. Steak is very expensive here in the Philippines.
Yes.
So right
Yep.
now, our diet consists of like a ground beef, eggs, and chicken. Once a week or once every 2 weeks, we will eat cauliflower, but that's it.
Yeah, no, that's fine. And so you're doing a carnivore experiment.
Mhm.
After 60 or 90 days of that, if you say, I felt just as good on keto and it was cheaper, then go back to your keto. That's totally fine. But I think if anybody is curious about the carnivore experiment, I I think it's perfectly safe and I mean it's smart to just say I'm going to try that for 60 days or 90 days. And
Mhm.
because what happens with human beings is we get accustomed to where we're at right now. And so a lot of people on keto think they feel amazing, but then they try 60 or 90 days of carnivore and they say, "Holy moly, I just thought I felt good on keto. I even feel even better on carnivore." But then some people don't. And so I think it's a great experiment to do. And then you get to decide, am I going to keep eating veg or am I not going to keep eating veg? Because now you know from experience because you did the experiment yourself. Yeah.
Yeah. I used to have a very bad insomnia. It started when I was in grade school. I tried everything. I only became okay when I started doing keto. But when I did carnivore, my sleep became
Right.
better. Yeah.
Right.
Because
Yeah. And that's
before,
pretty amazing, right? To be able to sleep. Yeah.
yeah, and I didn't even thought that I have something like I have a disease or whatever, like something's wrong with me because my weight is okay, so I'm probably okay as well. So yeah, anyway, I want to talk to you about the like net carbs versus total carbs. And right now in the Philippines, keto diet, carnivore diet, low carb diet is becoming popular. So the companies, the slimming companies, of course, are using the name keto, low carb, just to just to sell. But
Yep.
if you are going to look at their ingredients, some are really bad. Like they have like 5 types of sugars. Some, they say that everything is organic, everything is keto, but looking at the total carbs, it's 30 grams per serving, but it's fiber. So the only total carbs is 2 grams. So this should be keto.
Yeah.
So,
Yeah, I have a big problem with corporations doing that. And I understand they're just trying to make a profit. That's their job. But that's why I'm a big advocate of counting total carbohydrates because first of all, some of that fiber is absolutely digested.
mhm,
Now, you may not get 4 calories per gram of fiber, but there are many research studies that show that you get 1.5 calories per gram of fiber or some fibers like oat fiber and chicory root fiber, you get up to 2.5 or 3 calories from a gram of that. A gram of carbohydrates 4 calories, so you're almost getting the same thing. But they technically they can call it fiber and say it doesn't count. I don't believe that at all. I count total carbs, and I think that eliminates a lot of confusion and it eliminates the ability of these less than honest companies to try to put the word keto on their product and then trick you and get your money and then you not get a good healthy return for that. The other thing that I'm a big advocate of is that ingredients absolutely matter. They matter greatly. You can have a product that only has 2 grams of total carbs that has sugar, wheat, soy, and canola oil and sunflower oil, and it still just have 2 net grams of carbs. Is that healthy? Is that, I mean, those things are poison to the human body. It's not just about the net carb count, it's about the total carb count and it's about the ingredients. Both of those things matter very, very much. You know what? You know what motor oil is, right?
mhm,
That you put in your car?
yeah,
Motor oil is keto. You could drink that and it would not raise your blood sugar. You see my point? You can
yeah,
slap keto. You can eat, I mean, you could eat sawdust. It's
mhm,
because it's
mhm.
pure fiber. It won't raise your blood sugar at all. Sawdust is keto. That's not okay. Ingredients matter. Ingredients are very, very important. And the total carbohydrate count is that those are the two things that if people focus on that, they won't get tricked by the food companies.
Yeah, unfortunately, a lot of people are getting tricked.
I know.
And yeah, it always excites me whenever you post something about this is not keto. I always share it on my group because, like, yeah, please do more. And sometimes I do it on my channel, but unfortunately, now the companies are no longer showing the ingredients. Like, if you will go to their website, the ingredients is not there.
Oh, see,
Yeah,
that's so dishonest.
and I don't want to buy their products. I don't want to buy someone's product just so I can do a review about it. So yeah.
I hear
Yep.
you. Yeah,
Mhm,
but you
mhm.
just all you can do is educate people and help them understand. Number one, count total carbs. Number two, ingredients matter very much. And then it's really hard to trick those people at that point because if they see if you and you know if you see something that says keto on the front of the package, 100% of the time you need to read the ingredients
Yeah,
because it's becoming very popular right now and people are trying to trick you.
true. And the worst part is if something happens to them, it's keto's fault. It's not the
Exactly.
product's fault. Yeah. Anyway, thank you so much thank you so much, Dr. Ken.
Yeah, my pleasure. Hey, do you have a Facebook group for
Yes.
keto?
Yeah, I do.
Am I a member?
Facebook group, no. Can I add you?
Yeah, send me an invitation.
Okay. Thank you.
Yeah, yeah.
I also
It's
have a
been a
face.
pleasure.
It's been a pleasure as well. I also have a Facebook page where I always like share all your posts, and I am going to link all of the videos that you mentioned. So, yeah, thank you so much. And I know I'm already taking too much of your time, especially that I'm so nervous and I couldn't speak properly. I couldn't ask proper questions.
It's been a pleasure chatting with you. It's been a lot of fun. We'll have to do it again
Yeah,
sometime.
please.
Yeah,
Yeah, please. I'm really excited to looking forward to do this again.
yeah.
So yeah. Thank you so
Have
much,
a
Dr.
wonderful
Ken.
day.
You
Thank you
too.
very
Bye.
much. Bye-bye.
Sorry, I was trying to speak, but my headset is not connected to the computer. Yeah. Like I'm so excited and now I'm shaking. But
You're making me nervous now.
I'm really looking forward for this conversation, but I don't know what's happening to me. I'm shaking. Maybe I'm just so excited to have you. Oh my god, what's happening to me? Does this always happen or is it just me?